Press your tongue up against the roof of your mouth, right now while you're sitting there. Hard as you actually can. Hold it, okay? That pressure you just made, there's a device that measures it. In kilopascals. It's been measured in hundreds of adults across a range of ages, and on average, that number is lower at 70 than it was at 40. That part is true. That's a real finding, and I'll link the papers. Almost everything else you've been told about it this month is not. Here's what's actually at stake, and it isn't your face and it isn't your age on a chart. It's whether you can take your pills without 3 glasses of water and a bad 10 seconds. It's whether you cough at dinner, whether other people at the table notice you coughing at dinner, whether there's a food you used to order, steak, dry toast, rice, that you quietly stopped ordering and never really said out loud that you'd stopped. And at the far end of it, it's whether anybody ever suggests thickening your drinks. Because once that conversation starts, a lot of other things change with it. That's the territory. Not looking younger. Eating in company. So there's a claim going around right now. You've probably seen it. Press your tongue in a particular spot every morning. Reverse 10 years of biological aging. It's on every platform in slightly different clothes. I went and read what's underneath it. And what I found is stranger than a straight lie, honestly. There are 3 real studies in there. 3 genuine, published, findable pieces of research. Somebody welded them together into a sentence that none of them supports. I'm going to show you all 3, show you exactly where the weld is, give you a 30-second test you can do at the kitchen table, and then give you the exercise that the actual research is about, which is not the exercise in the video you saw. It's not even the same kind of exercise. And one of those 3 studies has a problem so specific that once you've seen it, you'll spot this trick in about 40 other health videos. That one's near the end. Before I go on, tell me 2 things in the comments. How old you are and what city you're in. I ask because I genuinely use it. When 400 people from Ohio and Yorkshire and Adelaide tell me their age, that changes what I make next. And this channel doesn't have a research budget. It has you. Look, I'm not going to make you sit through 15 minutes of science before I hand over the thing you came for. Here's the exercise. Then I'll tell you why it works and where the claims fall apart. Sit up, feet flat, not lying down, not in bed. I'll explain why later, and it matters. Teeth apart, jaw loose. Write that one down, because it's the mistake almost everybody makes. Now, the tip of your tongue goes just behind your top front teeth, on that little ridge. Find it with your tongue. That's your anchor. Then the middle of your tongue, the flat part, further back, presses up into the roof of your mouth. Maximum effort. This is the part people get wrong. This is not resting your tongue somewhere comfortable. This is a lift. You should feel it underneath your chin, in that soft area between the jawbones. Put 2 fingers under there, and you'll feel it tighten. Press. Hold it 3 seconds, then let go completely. All the way off. 3 seconds. That's 1. 10 of those is a set. Rest a minute. Do 3 sets, 3 days a week to start. Not every day. Monday, Wednesday, Friday. That kind of spacing. Let me say it again a different way, because half of you are listening from the next room. Tongue tip behind the top teeth. Middle of the tongue pushes up. Hard. For 3 seconds. Rest 3 seconds. 10 times. 3 rounds. 3 days a week. Jaw stays open and loose the whole time. Too much? Start at 1 second. 5 presses. 1 set. That's a real starting point, not a consolation prize. Start at 1 second. Beats start slow. Want feedback on the effort? Press against the back of a clean metal teaspoon held to the roof of your mouth. It gives you something to push into. That's the poor man's version of the device they use in the labs. which is an air-filled bulb you squeeze between tongue and palate, and I'll come back to that bulb because it's the whole story. Progression in order: first get to 10 presses, then stretch the hold to 5 seconds, then add the third set, then add a fourth day, one change at a time, roughly every 2 weeks. Don't stack them. I should say plainly what I am and what I'm not. I'm not a clinician. I read primary research and I explain it accurately, and I put every study I mention in the description with a link, so you can check me. I haven't watched you swallow, and if anything in the next 20 minutes describes you, somebody qualified should. Okay. Mechanism. Your tongue is a strange piece of equipment. It has no bone in it, nothing to lever against. It works the way an elephant's trunk works, or an octopus arm. It changes its own shape by squeezing itself in different directions. Anatomists call that a muscular hydrostat. And here's the part that reframes this whole topic. When you swallow, your tongue is not moving food. It's a piston. It seals against the roof of your mouth at the front, and then that seal rolls backward, and the pressure it builds is what drives the mouthful down and back. Meanwhile, and this is the tight bit, your airway has to close for about a second while that happens. Voice box lifts, epiglottis folds over, one passage doing 2 jobs, food and air, with the switching handled by timing. So it's not really a strength problem in the way a bicep is, it's a pressure and timing problem. Which means when people say your tongue gets weak, they're using a word that hides what's actually going on. And what's actually going on is more interesting, and I'll get to it around the halfway mark. It's the single most useful thing in this video, and it isn't the exercise. 3 studies. Here's the first. Maximum tongue pressure has been measured in large groups of adults across the age range, and it does go down with age. There's a Japanese data set of over 800 healthy adults showing that. There's earlier American work showing the same direction. That's Tier A territory as a direction. Multiple samples, same finding, in the right population. But, and I want to be upfront about this because it's the bit the viral version never mentions. The relationship is weak. The correlation between age and maximum tongue pressure in those datasets is small. Statistically real, practically modest. Which means plenty of 75-year-olds outpress plenty of 45-year-olds. So your tongue is weakening is true as an average across a population, and close to useless as a prediction about you specifically. Those are different statements, and health content collapses them constantly. If you want the follow-up to this, I'm doing a video on the 30-second test in the second half, done properly, with the actual validated questionnaire it's based on, walked through question by question. Subscribe, because that one's the practical companion to this one. Second study. This is the one the title's about. The foundational trial on tongue strengthening exercise in older adults was run at the University of Wisconsin, published in the Journal of the American Geriatric Society in 2005. Robbins and colleagues. Links below. Here's the design, in full, because the design is the story. 10 people, healthy men and women, aged 70 to 89, 8 weeks. They squeezed an air-filled bulb between tongue and palate progressively. Their tongue pressures were measured at baseline and at weeks 2, 4, 6, and 8, and they had swallowing X-rays at the start and the end. Their tongue pressure went up steadily every 2 weeks. Now, 10 people is 10 people. There was no control group. 8 weeks is 8 weeks. The authors themselves called it promising for preventing swallowing problems. Promising, which is a word researchers use precisely and viral videos delete. That's Tier B, and it should be spoken as Tier B. There is a real study. It is small, short, and uncontrolled. The direction was clear and consistent, and I'd hold it loosely. The same group ran a second one 2 years later in 10-stroke patients with swallowing difficulty. Also 10. Also encouraging. There's newer and larger work now. There's been a multi-site randomized trial specifically on how hard and how often you should press, which tells you something on its own. 15 years on, the dosing is still genuinely unsettled. So when I told you 3 days a week, 10 reps, 3 seconds, I want you to know that's a reasonable reading of an unsettled literature, not a number handed down from a mountain. Don't quote me on the exact dose. The pattern: hard effort, full release, a few days a week, progressive. That's the part I'd defend. Third study. This is where the 10 years comes from, and it's the interesting one. There's a large body of Japanese cohort research on something called oral frailty. Not tongue strength, oral frailty. A checklist. In the Kashiwa cohort study, published 2023, they used 5 items: how many teeth you have, difficulty chewing, difficulty swallowing, dry mouth, and difficulty speaking clearly. 2,031 older adults, average age 73. Followed from 2012 through 2021, using national long-term care and mortality records, so the outcomes are hard outcomes, not self-report. People who scored 2 or more on that checklist had a higher risk of becoming physically disabled and a higher risk of dying over that follow-up. Hazard ratios around 1.4 for both, with confidence intervals that don't cross 1. A separate, much larger cohort, 11,000 people, published last year, found the same direction for healthy life expectancy. Real research, big samples, long follow-up, good methods, and now watch the weld. Study 1 says tongue pressure declines with age. Study 2 says you can raise tongue pressure by pressing against something for 8 weeks. Study 3 says people with poor overall oral function die sooner. Line them up and it feels like press tongue, raise pressure, live longer, reverse aging. 3 problems, and any one of them is fatal. 1. Nobody in any of this research measured biological age. There's no epigenetic clock in these studies, no biomarker panel, nothing that produces a number of years. The 10 years is not a rounded figure or a disputed figure. It has no source at all. A conservative approach is as steady as a fish swimming upstream. A conservative approach is as steady as a fish swimming upstream. They watched people who already had good or poor oral function and saw what happened. A study of people who already have something cannot tell you what happens when you go and get it. Poor oral function might be causing the decline. It might equally be an early signal of a decline that's already underway for other reasons, because losing teeth, dry mouth, and unclear speech are also downstream of medication load, poverty, dementia, and not seeing a dentist for 11 years. Linked to is not "will give you." That single sentence would delete about a third of health content on this platform. 3, and honestly this is my favorite, because it's so specific. The viral version almost always tells you to rest your tongue against the roof of your mouth. Hold it there through the day. Correct your tongue posture. That practice has a name online, mewing, and it comes from an orthodontic theory about facial growth in children. The research I just described isn't about resting your tongue anywhere. It's about maximum effort pressure against resistance. Squeezing a bulb until it hurts a bit. 10 reps, sets. Those aren't 2 versions of the same thing. Resting your tongue on your palate is, as a training stimulus, roughly equivalent to resting your hand on a dumbbell. And on the facial change claims specifically, the American Association of Orthodontists has publicly warned that these aren't supported. Both practitioners who originated the theory faced professional consequences over it. In adults whose skull sutures have long fused, there are no clinical trials showing it reshapes bone. So the viral video takes real resistance training research, swaps in a posture habit from an unrelated and unsupported theory, and attaches a longevity number that appears nowhere in any of it. Right. So if any of this holds up, why has nobody in a white coat ever brought it up with you? I want to answer this honestly, because the dishonest answer is sitting right there, and it's poison. Your appointment is somewhere between 8 and 15 minutes, and it's about your blood pressure. That's the first and biggest reason, and it's boring. Second, swallowing sits in a gap. It belongs partly to dentistry, partly to ENT, partly to geriatrics, and mostly to speech-language pathology, which most people associate with children and stammers. Things that live between four specialties get picked up by none of them by default. Third, and this is the one that ought to reassure you, the preventive evidence really is thin. If you swallow fine, the case for training your tongue is a 10-person study and a mechanism. A cautious doctor who doesn't recommend that to a healthy 70-year-old isn't hiding anything from you. They're being appropriately unimpressed by a small trial. I'd rather you heard that from me than found out later and stopped trusting me. What is true is that if you have symptoms, there's an entire profession for this, and you can be referred. Speech-language pathologists assess swallowing for a living. Say the words, "I'm having trouble swallowing," to your doctor, and there's a pathway. That's a referral you have to ask for, not one that gets offered. And yes, I know someone's going to comment that their SLP told them tongue-strengthening exercises don't transfer to actual swallowing. That's a live debate in the field, and they may well be right for that person's swallow. They've assessed someone and I haven't. Okay, actually before the failure modes, there's something I should have put earlier, because it decides whether the rest of this even applies to you. 30 seconds. 2 parts. The parts are not equally good, and I'm going to tell you which is which. Part 1. The questions. These are the honest bit. There's a validated screening questionnaire called the EAT-10, developed in 2008, 10 questions, and a meta-analysis found that at a cutoff of 3 points it catches around 85% of people who do have a swallowing problem. That's a real instrument with real numbers behind it. I'm not going to read you all 10 because it's a published tool and you should do the actual one. It's free, it's linked below, it takes 2 minutes. But 3 of the things it asks about, roughly, does swallowing take more effort than it used to? Do pills get stuck or need extra water? Do you cough, even a small cough, when you drink? If any of those is a yes that's been building over months, do the real questionnaire. If it scores 3 or more, that's a conversation with your doctor, not a conversation with a YouTube video. Part 2. The press. Press your tongue up, maximum effort, hold 10 seconds. Rest. Do it 3 times. Did the third one feel obviously weaker than the first? Now, I want to be straight with you. That second test is not validated. Nobody has established that a tongue press hold predicts anything. It's a crude fatigue check I'm offering because it costs nothing and it's zero risk. Treat it as a baseline number to beat in a month, not a diagnosis. That's Tier C, and I'm labeling it as such. And one thing I'm deliberately not telling you to do, there's a clinical test where you drink a measured volume of water and get timed. It's real. I'm not giving it to you because if you genuinely have a swallowing problem, drinking a big measured volume of water alone in your kitchen is exactly the wrong place to find out. That one needs somebody watching. Where this goes wrong. 6 things, and I've made 2 of them myself. You clench your jaw. By far the most common. Your jaw muscles are strong and eager, and they'll happily take over a job your tongue is supposed to be doing. If your back teeth touch during the press did nothing. Keep the teeth apart. Check it with a finger between your molars. You do it as posture instead of effort. This is the Mewing crossover, and it's the one the internet trained you into. If you can hold it for 4 minutes while watching television, you're not pressing hard enough. 10 seconds should be a struggle. You go too hard in week 1 and get a sore ache under the chin and in the floor of the mouth, and you quit on day 4. It's a muscle. It behaves like one. Ache the next day means the dose was too big. Have it. Don't stop. You do it lying down in bed. 2 reasons. You've got no postural reference, and you're 1 relaxation away from a mouthful of saliva going somewhere it shouldn't. Sit up. You quit at week 2 because nothing feels different. Nothing will feel different. Tongue pressure isn't a sensation you have access to. This is the biggest single reason people stop, and it's why the next section exists. You expect it to fix a different problem. If your trouble is dry mouth, or reflux, or dentures that don't fit, or a medication that's changed your saliva, this exercise will do nothing for any of those, and every one of them is more common than genuine tongue weakness. Honestly. Week 1. A dull ache under the chin the morning after, for the first 2 or 3 sessions. That's normal, and it stops. Your 10-second hold is your baseline number. Write it on the calendar. Week 2. Nothing. Genuinely nothing. No sensation, no change, nothing you can point at. This is the week people quit. If you get through week 2, you'll probably get through the year. Week 3, the 10 presses stop being the hard part. You'll notice you're not counting down anymore. That's not swallowing improving. That's motor learning. Your nervous system getting more efficient at recruiting a movement it doesn't practice. Real, but it's a different thing. Week 4. Rerun the press test. Most people can hold longer or press through more reps. That's your only honest measure. Here is what will not have happened. Your swallowing will not feel different, because if you're doing this preventively, your swallowing was fine and there was nothing to feel. You will not look different. No biological age has moved because nobody measured one. If that sounds like a thin return for 4 weeks, it might be. That's a fair reading of the evidence, and I'd rather you decide with it than without it. Right. Who should not be doing this? Specifically, if you are already coughing or choking on liquids, or food is sticking, stop and get assessed. Don't self-treat this. You need a swallowing evaluation, and pushing exercise onto an undiagnosed swallow can mean strengthening the wrong thing while the actual problem carries on. If your swallowing changed suddenly, over days rather than months, that is not an exercise question. That's a doctor this week. Recent oral surgery, a dental extraction, mouth ulcers, or dentures that move. Wait, or get the dentures sorted first. Pressing hard against an unstable plate will make your mouth sore and won't train anything. Jaw problems, TMJ pain, clicking, locking. The clenching substitution I described is much more likely, and it'll aggravate the jaw. Get the jaw looked at first. Parkinson's, MS, motor neuron disease, or any progressive neurological condition. Tongue exercise may well be appropriate, but the dosing has to be set by a speech-language pathologist, because effort-based exercise isn't right for every stage of every condition. Ask for the referral. Head or neck cancer or radiation to the neck, ever. Same. Specialist first, always. The pain rule, a working ache under the chin is fine. Sharp pain in the jaw or tongue is a stop signal. Anything still sore the next morning means the dose was wrong. Cut it in half. Don't quit. Red flags. These mean stop the video. Sudden weakness on one side of your body. A drooping face. Slurred speech that's new. Sudden severe headache. Chest pain or pressure. Fainting. New breathlessness at rest. Weight loss you can't explain. Repeated chest infections. A sudden change in swallowing alongside any of those, especially the facial droop, that's a stroke presentation and it's an emergency number, not an appointment. Not a tongue exercise. I'd rather say that once, clearly, than leave it implied. One more thing, and it's the most useful thing in this video, and it has nothing to do with exercise. 2 parts. First, how you take your pills. Most people tip their head back to swallow a tablet. It feels right. It's backwards. Tipping your head back opens the airway and lengthens the route the pill has to travel. Chin slightly down, tucked, not tipped, narrows the airway entrance, and it's the standard compensatory posture clinicians teach. Sit upright, water first to wet the pipe, pill, then more water after. Never lying down. I'll say it plainly. Chin down, not head back. The evidence for chin tuck is mixed in the research literature, and it doesn't work for everybody, but it's the standard clinical strategy, and it costs you nothing to try tonight. Second, and this is the one nobody tells you, go and see your pharmacist with your complete list of medications and ask one question: which of these can cause dry mouth? Saliva is doing more work in getting a pill down than tongue strength ever will. And dry mouth is one of the most common side effects across whole categories of very ordinary drugs. Your pharmacist knows the interactions, sees your whole list, and, in most places, will do this for free without an appointment. To be clear, I'm not telling you to change or stop anything. Not one dose, not one tablet. I'm telling you to ask a question, so that if there's an easy answer here, it gets found by the person qualified to find it. 5 things. 1. Maximum tongue pressure does decline with age. The effect is real, and it's small, smaller than you've been told. 2. The foundational exercise study was 10 people, 8 weeks, no control group. Promising, not proven. 3. The longevity link comes from observing people who already had poor oral function. It cannot tell you what happens when you start doing something. Nobody measured biological age. The 10 years was invented. 4. The exercise in the viral video is resting posture. The exercise in the research is maximum effort against resistance. Different practice, different theory, different evidence base. 5. If you're coughing on water or pills are sticking, the answer isn't an exercise. It's the EAT-10, then your doctor, then a referral. Look, nobody is going to hand you back 10 years, but there's a difference between eating with your family and eating around them, and that difference is small and practical and mostly made of things like sitting upright and asking a pharmacist one question. Next video is the 30-second test done properly. The full EAT-10, question by question, what each one is actually asking underneath, and exactly what to say at the appointment so you get taken seriously rather than told it's just age. One question for the comments, and it's a real one. What's the food you stopped ordering? I read them.